Good afternoon and welcome to the December 2023 Pitt County Department of Social Services Board Meeting. I would like to call the meeting to order and observe a moment of silence. Thank you. Do we have any public comments?
Yes, sir.
Do we have any changes to today's agenda?
Yes, we have two changes. The recognition of new hires and retirees, they are not available to come to our meeting today. And our Excellence Award for Candace Franklin, she is also out of the office, so we will postpone that till the January meeting.
Okay, can I have a motion to adopt today's changes to the agenda?
So moved. Second.
Second.
No, second.
All in favor?
Aye.
Aye.
Thank you. You all should have received minutes from last month's meeting. Can I have a motion? Are there any changes to those meetings? If not, can I have a motion to approve last month's
So
meeting?
moved.
Second.
All in favor?
Aye.
Thank you. At this point, we're going to have an Excellence Award presentation. Mr. Brown, front and center.
So we have before us Charles Brown, who is receiving the Certificate of Excellence. This is a certificate for brilliant and consistent high standards of workmanship, signed on this day by the Director of Social Services and the Chairperson of the Department of Social Services Board is proudly to present Charles Brown. It talks in here about what he actually did, but I'm going to go into a little more detail because when I say that Charles went above and beyond is an understatement. What occurred was the week of Thanksgiving, we had an adult services client who basically left North Carolina, and we found him up in Pennsylvania. And so in order for the gentleman to come back to our county, we had to have someone fly up there, meet with him, and fly back to North Carolina with him. So Charles, who does not work for adult services but works for our assessments area, volunteered to go up, and he did. He flew up only to get stranded in Pennsylvania because of bad weather. Had to spend the night, oversee the client, and luckily we were able to find a different flight for him to come back the next day. But not only was he willing and able to do what he did, but there's not enough thanks, Charles, that I could say for what you did. I mean, volunteering and then getting stuck up there right before a holiday, and the fact is that we were able to get you home, but thinking that we wouldn't be able to do that till Friday. So, this Excellence Award is given today for you went above and beyond anything we could have ever asked anybody to do. And you always do it, but this one actually needs, I think, to have some public report out of the wonderful job that you did. So, thank you for that.
And that's going beyond the call of duty. That is going beyond.
All right, next we're going to have items for report. Dr. Matthews.
Welcome.
Hi, thank you. Thank you so much for having us here this afternoon. And I'm Jennifer Matthews. I'm a faculty member in health education and promotion at ECU. And this is my colleague. I'll let Erin introduce herself.
Yes, I'm Dr. Erin Roberts with ECU, Human Development and Family Science, and the Family Therapy Clinic Director.
So we oversee a lot of the trauma-informed work for Pitt County, really eastern North Carolina. And we are here today to present a trauma-informed DSS project that we'll be working with Pitt County DSS. Really, the contract's already gone through. We're just working on everything will be implemented starting in January. So part of that research project, or part of that project initiative to begin with, is based on the community resiliency model. I am a community resiliency model trainer, and basically what that largely is looking at emotional regulation, and then also as a way of handling stress and or trauma that individuals have experienced. It is a evidence-based model that includes 6 wellness skills, which I'll show you what those are in a few minutes. But this serves sort of as the foundation for what the project will hold. The resiliency model that we will be using has been tested across lifespans, across different diverse cultures, literacy abilities. Everybody from the age of 2 to I think the oldest that I've seen is 102 has been able to learn about this model and then utilize the wellness skills as a way of handling ongoing stress or trauma that they might be experiencing, but then also really what it comes down to is sort of an emotional regulation type. And the model is really based on the fact that your response to stress and or trauma is biology. It's essentially a nervous system reaction. And so it is very common for all humans to have reactions to stressful and traumatic experiences, and they do impact both mentally, physically, and spiritually your body. And so a lot of CREM is really recognizing those connections and putting those pieces together so that individuals kind of have their own aha moment, recognizing some of the physical reactions that they might be having and connecting that back to some prior experience or some sort of traumatic or stressful experience that has occurred. And it greatly impacts how you show up in the world. And so it's really a part of being able to listen to your own body. I talk a lot about like your gut feeling. That gut feeling that you have is really a nervous system response telling your body's telling you something. And it works the exact same way when we utilize some of the wellness skills and the resilience model as a way to listen to ourselves, listen to how our body is reacting in certain circumstances, and then applying some of the wellness skills, and they're very simple wellness skills, to allow you to better regulate yourself. And these are the 6 wellness skills that are presented as part of CREM. Tracking is in the middle, and that's because you can't CREM without tracking. Tracking is listening to our own bodies and doing that piece, that listening to your gut reaction, how it's showing up in your body. And so looking at that and then applying different wellness skills, which some of these may be very familiar to you. Grounding, for example, is sort of your space, your time and space. Help nows are things that you can do to immediately reset your system, and resourcing or pictures or images, and gesturing is what I do. Gesture using my hands, or some people it's hair twirling, some people it's they're playing with their rings, whatever. But really it's about applying these skills in a way once you're listening to your system to better able handle your stress and on a day-to-day basis, as well as handle some of the stress that you might have experienced in a traumatic experience. So learning these skills and being a part of this research or being a part of the project will help people understand that what they might be feeling or experiencing, it's biology. It's not some sort of mental weakness that we often apply in a mental health sort of situation. So a person, I always like to say that we are all individual icebergs with our own suitcases. How much of my iceberg, the tip of my iceberg I show you, depends on the relationship I have, the closeness, the trust that we build. But I have a suitcase that I carry with me everywhere I go, and it has all of the experiences that have made up the 42 years I've been on this planet, and it affects how I show up to you today or how I show up to my students at ECU. You can't see my suitcase, just like I can't see yours, but you also have one. So it's this recognition piece that individuals show up with their suitcases, and they can show you a lot of their iceberg if they would like to. They might show you just a tip, but their suitcase still exists. And so it's really about putting that into perspective, allowing individuals the grace and empathy based on how they're showing up in the world, based on the experiences they have, and then applying wellness skills to help self-regulation. And you can also help other people co-regulate by using these skills. I use these things on my children all the time. That's really what CREM is sort of based on, and what we will serve as sort of the foundation. And then Dr. Roberts will talk a little bit about the specifics of the research project.
Yes. Thank you so much. I'm very excited about this work. I previously moved from Louisville, Kentucky, and there one of my mentors for the PhD program was working heavily with DSS up there. It was called CPS up there, but did a project that looked at many of the things that we are hoping to look at, and found some things that were very startling, but then started a movement towards creating something fresh, and creating more supports and more wellness. She had found, actually, they had done, one of our measures is going to be on depression, and she had actually found that the majority of DSS workers that were direct service workers actually met the criteria for clinical depression. And so this project is very near and dear to my heart as well. So stages of the project, research. So the first part of the project is going to be to gather data, to kind of see what is going on. We're going to be meeting with leaders to be able to find out what is it that you all want us to look at, and what is it that you all want, so you can all have input on this as well. We also are going to be gathering what we call BPSS Wellness Survey, a biopsychosocial spiritual wellness survey throughout DSS, to find out kind of what is going on and what are the needs that need to be addressed. Then the next stage of the project will be data analysis. So we're going to take what we learned from those surveys, and we're going to analyze the survey for some of the overall trends that we're seeing. And with that, that is really going to drive the rest of the project. And so we will be having further interviews with DSS workers. We're going to, that survey, so we don't have the survey questions for that yet, because we are going to have that be driven by what we find. That will give us more in-depth, and give us all in-depth knowledge into kind of what is going on. And we're also going to be conducting those interviews we're going to complete those DSS interviews. And then finally, we're going to also be doing implementation, which will include 3 to 5 CREM sessions, 30-minute huddles for CREM, which is a support to kind of keep those CREM skills fresh and new and continue them going on, and then also to determine kind of what those next steps might be. All along the way, we also are going to have employee support built in. So having those wellness skills that they have learned through the community resilience model, and the huddles that will keep those skills up. We'll also be offering therapeutic support, so having 6 free sessions at the ECU Family Therapy Clinic. We actually just hired a assistant clinic director. Yay for me. Finally, so we have an assistant clinic director who is going to be trained in EMDR. And it really is half-time assistant clinic director and half-time therapist. And so we'll have 20 hours a week to devote to therapy. We also have a couple students who are also trained in EMDR. I'm trained in EMDR myself. And for those of you who don't know what EMDR is, I should clarify, eye movement desensitization and reprocessing. So it is a therapeutic method. It was originally for the treatment of trauma, so it's very trauma specific, but has also been shown in research to be very effective to reduce anxiety, to reduce depression, and so whole number of things, and in 6 sessions or less. to the research is showing. So it's a brief intervention, and a very effective intervention. So, we're a big fan of it over there at the Family Therapy Clinic. So,
Tell me again what you said it stood for.
I'm sorry.
Tell me again what you said IMDR stood for.
Oh yeah, eye movement, desensitization, and reprocessing. So it actually uses the eye movement, so it crosses over both hemispheres of the brain. So you use eye movements to go back and forth. The therapist can use that either through like their fingers where you'd watch, their fingers go across, or through a light bar. There's also kind of electronic kind of they're called like pulsometers, and so they do a little pulse on each hand, which then just also moves the like the neural attention from this side, from the left to the right side, and so it mimics, in a way, you can think of it as it mimics REM sleep. So as you process things during your day through sleep, it very much does that artificially through therapy. So.
And it's EMDR.
Yes,
Just
E.
that, I thought that was.
Okay, I was not sure.
Yeah.
Okay.
Oh, did I say?
No, you
That's
said
my
EMDR,
accent.
but it was the I, because you said I like eyes.
Oh, okay.
Yeah.
Okay, got it. Okay.
Thank you.
Yes. All right. So that's EMDR. And if you all have any questions about any of this, please feel free to contact myself or Dr. Matthews. And then access to findings too, that there is something too, that this, that being a part of something, being able to, you share a part, right, that becomes a part of the aggregate data, and then you get to see kind of the overall results, which can also, I think, for certain things, help you to feel like, okay, I'm not alone in this, right? And so there is some investment kind of in the outcomes. And I think it also says something too about the support from leadership as well, that, we're willing to look at this, and some of it is going to look great, and some of it might be some things that, okay, we need to look at. So I think that can be very supportive in and of itself too. So, okay. Here are a few things as far as the biopsychosocial spiritual inventory. So on the biological, sleep and appetite can be a big indication of how someone's biological functioning is going well. So, so we have some questions as far as appetite and kind of eating, and whether someone is eating when they're hungry or not. And so, and various things that can indicate kind of maybe some things going on. Then also some sleeping. So is somebody getting good sleep? And that's not just like the 8 hours or 6 to 8 hours recommended or whatever. This is someone having frequent nightmares, right? And that can also be indicative of something like PTSD going on as well. So, so an overall perceived health measure, how they feel physically, right? So that is what is measured in the biological piece.
Yeah, this is removed. I can explain that.
Okay, the brief stress and
Yeah,
resilience
so the
scale.
brief stress and resilience scale is something that we currently use very often when we do any type of resilient or trauma-informed work. And the idea is to do measure their stress and then how they're capable of bouncing back that resilience piece. And of all of the measures that are out there, this is the one that seems to be the most specific in measuring sort of our own resilience and our own biological stress. So that's the one why we will use that one.
And then the GAD-7 and the PHQ-9, which some of you may be familiar with, those are the most frequently used measures for anxiety and depression. The supervisor relationship scale. So I had mentioned that one of my my mentors, Dr. Anita Barbie, who's up in the University of Louisville, what she did with that data, once we found out about clinical depression, she looked into some of that. And one of the measures that she used and found was that having a good relationship with one's supervisor and with one's work peers really made a difference in how they felt overall, not just at work, but overall how they felt their overall well-being. And so we wanted to include kind of a workplace burnout and supervisor relationship scale to be able to look at what things can be tweaked. What do we need to look at? The subjective units of distress, so perceived stress daily. And we also want to look at that to see if maybe that gets improved by some of these interventions. The social provision scale, so what kind of social supports do they have outside of work? And then the multidimensional workplace environment scale. So this is looking at the overall workplace environment as well.
And that specific scale, there are so many workplace environment scales.
Yeah.
And what we really liked about that one is it actually took different pieces of workplace environment. It didn't focus on one specific aspect of the environment. It allows for, I think there's 7 or 8 different aspects of the environment at work, all built into one sort of area.
Yeah, we did take with each one of these, we took a long time to consider kind of each one. We looked into a lot of different ones just to make sure we weren't exhausting people with the number of questions that we were asking, but we were asking things that would give you all really good information and usable information. So, okay, is that one? I think that's it. Let me see if this. Yes, the thank you slide. Yes. So thank you so much for your time. Do you all have any questions for us?
I do.
Yes.
I always do. Thank you so much for this presentation. I wrote down my questions as you were talking. How do you plan to get the participants for this project?
Good.
So we are fortunate enough that DSS has been willing to handle, we're doing this on behalf of DSS. So we're collecting the data, but really all the information in aggregate form will be given back to DSS. So Sharon has been a part of building this project. And I guess you weren't, I don't know if you were there that day, I can't remember, but we met with the leaders for DSS and they've already given us feedback on some of the survey questions. So they will be the ones that distribute it out to all of the staff at DSS. And then they've actually been generous enough to provide some incentives to increase participation. And then based on the survey, when they fill out the survey, if they are interested in participating in an interview, it'll actually send them to a completely separate survey where they can put their name and email address so that we can contact them for participating in the interviews. We just wanted to make sure that the name and the email was completely separate from any of the survey question responses, so that it is completely anonymous in how it is submitted.
So you're going to distribute surveys to everyone?
It'll be it's an online survey, so it'll just be sent out via
So
email.
to everyone at DSS?
Yep, that's
Oh,
correct.
okay, because I think that would be good. How long would this project last?
So we've set the contract up to be a year, but I would anticipate that the vast majority, I mean, I guess it kind of depends on data analysis, but the vast majority of it should be done in the next 7 to 9-ish months, with the latter part really working on, and really, I mean, you can say that, but it kind of depends on how long it takes to get the interviews conducted and working with people's availability. But it's set up to be a year-long project, with the latter part of that project really looking forward into what other steps can be done.
Okay, once the data is taken, will you share it with administration, Miss Rochelle? Sometimes I get names stuck.
Me too. Yes, absolutely. The plan is to put together an aggregate report of that information to be sent back for administration. And I know that in one of the meetings, Ms. Rochelle and I talked about actually providing some feedback either in a presentation or something back to all of the workers at DSS, the staff at DSS, so they can also see some of the results of that. Because we're really just collecting it and helping make sense of what we're seeing, and then giving it back to DSS for them to utilize in aggregate form to make sure that anonymity is consistent.
And you keep anonymity private?
Absolutely,
Oh, yeah.
yes.
Okay,
Yes.
I like that.
Yeah, absolutely.
Thank you.
And in my conversations with Aaron and Jennifer, so, you know, it was very important to me that it be done by a third party and not within the agency themselves, so that people are comfortable. I don't need to know who said what, I just need to know what the results are. And I want the staff to feel comfortable in saying whatever it is they need to say and answering truly what they're feeling. I also like the idea that even though there's gonna be training involved, it's really not a one and done. There's ongoing support for the workers, so while they're learning those aspects of CREM and having those huddles to be able to talk about what their experience has been, what they've done well, maybe what else they need to work on, and having that support be available to them. So while I've worked in 3 different states around this, there's similarities with the work no matter where you go. It is very stressful. I truly believe that we need to support our staff if we're going to have retention of staff. It's more than just getting them hired and trained, but how do we support them? How do we keep them well and healthy and feeling that they have an administration that cares about them? And so I'm hoping that throughout this next few months especially, we're going to be able to gather that information and come up with a plan that will continue to do that over a period of time.
I do know that social service work is stressful in itself, and individuals deal with so many aspects of human life and family life. And doing this should be rewarding for Pitt County Social Services. And anonymity is something that can gain the process of honesty and straightforwardness for the employee. And that way, it will benefit administration, I think, with sorting concerns, issues, and problems. I think I did it just right. Thank you. Thank you so much for sharing this.
I had 2 questions. One, when you talk about gathering the data with leaders, who's included in the leaders? Like, is it just administration? Is it program directors? Like, how far down does leaders go in the food chain?
Sharon, you're probably gonna have to remind me who I was but there were quite a few steps down. It wasn't in that meeting when we got initial feedback. And then our anticipation when we start planning the interview guide, because that is really largely going to be driven on what comes out of the survey. We have some ideas of things we want to ask, but we need the survey data to really make sure that that's accurate. But in doing some of that and developing that interview guide, I would assume we would go back to the same group or and get their feedback for that as well. So maybe you can tell who all was in that.
So in the initial meeting that we had, we involved the program managers. But I think when we actually sit down and talk about the data that we have gotten throughout the survey and the interview process, I would like also the next level of, so the supervisors that actually supervise the frontline workers, because I think it's important for them, for how they're perceived, how their workers are perceiving the work. I think it's just going to help them be able to direct that supervision and support from the information that we get from this, so.
And then my other question was, when there are new staff, like I look at the 30-minute huddles for 6 months, if a staff member came in at month 2 of the huddles, can they join, or is this very much you start at 6 months, you end at 6 months, and that's the people that are in it?
So anybody that goes through the CREM sessions can go, and you can go through multiple CREM sessions if you want. Like I don't even know how many I've sat in, and I learn something new and pick up different pieces every time. But at any time, if you go through any of the CREM workshops, you can join the huddles if you would like to.
Okay.
But the idea is just to kind of keep that movement, and I would like to see it extended longer than that. But again, that's up for. I have ideas about how to do that, but we're working on those ideas. But there is potential to keep it going within the system.
Okay, thank you.
What you say, the what kind of set, the CREM?
The CREM workshops. Sorry, that's what I call the community resiliency model.
Oh, okay. Oh, you got it.
CRM. I apologize.
I couldn't grab that.
Yeah,
and that's
yes,
what
I
you're using the
apologize.
initials and calling it CREM. Okay. Have you already done the survey? I mean, have you created the creative equity part of the survey?
Yeah, so the initial survey we've created based off of these pieces, so we already
Okay.
have it ready to go.
Okay, okay.
Yep, and then.
We're waiting
just
on,
gonna-
we're waiting on IRB approval right now, so once we get IRB approval, we anticipate that, man, I really hope before holiday break, so we can hit the ground running in January, that's the goal.
Yeah, that'll be a good time. Thank you.
Thank you so much.
Thank you.
Thank you.
Really
You're
valuable.
welcome. Thank you so much for your time.
Thank you.
Thank you, we appreciate it.
And I just want to say how I feel so privileged that you're going to be working with us. And, you know, you're right here at ECU, you're right in our backyard. The department really needs to utilize all of those, I call them gifts throughout the university that we've just never really engaged with. And so
Well, thank you.
you're both wonderful, and thank you so much for what you're doing for
We
us.
appreciate
Thank
it.
you. Thank you all.
Thank you. Next, we're gonna have,
I agree. Okay, I agree with you. Yes, that's good.
next, we're gonna have economic service update, Brian.
Good afternoon.
Good afternoon, Mr. Brian Avery.
In your packet is the Medicaid report card for November. The disability Medicaid applications, we were at 89% timeliness for that category. 90% is the state mandated requirement. So we were within 1%. Actually, when you look at the math, a lot of it has to do with the total number processed. We had 104 processed just for that category, and one application put us at 89%. So that happens sometimes, but we have, our program manager, intake program manager, Teresa Sampson, has identified the issue and is following up on that. The other category, we are at 93%, and 90% is also required for that category. Also, at your seat, we have added a handout on Medicaid expansion. There are two, actually. One is the numbers that I've pulled together, and then the other is a flyer provided by the Department of Health and Human Services. This is a flyer that they have developed and have available online, and they've used it in press releases so that it just sort of boils the program down into a one-page flyer. It shows the income, general income limits, the general guidelines for the program. It also talks about the access portals to apply for Medicaid expansion. One is through epass.nc.gov. That's the through the internet, the electronic way to apply. There's also a website where if somebody wants to print out a paper application and prefers to fill it out by paper, they can do that. They can come in and see us at 203 Government Circle and make an application in person, or they can call if they don't have access to any of the other portals and want to call. Their application can be done by phone. So it's easy access because you don't have to have internet access. You don't have to come to the agency in person. It can be done by paper. Some people prefer to do the paper application, and we're fine with that too. So however an individual chooses to apply, they do have that access. The other handout, I just wanted to sort of highlight the numbers of beneficiaries. In North Carolina, there are about 2.85 million Medicaid beneficiaries in any of the Medicaid programs that are available. In Pitt County, our total is 55,782. And in previous discussions of Medicaid expansion, I've spoken about the conversion of those who were receiving in a lesser benefit program of Medicaid. So the figure for North Carolina is, as of last Friday, December 1st, with the implementation of the program, In North Carolina, 259,942 Medicaid beneficiaries have been converted to full Medicaid. In Pitt County, the number is 5,386. So that's 5,386 individuals that have now gained access to full Medicaid coverage. They also have been enrolled in a health plan through managed care and have received that information of which health care plan they're in. So the last figures are the numbers that are projected that are still potentially eligible for full Medicaid. In North Carolina, there's still about 340,058 individuals still eligible. In Pitt County, based on the projected number, 7,480. So that gives you an idea of the impact of who has already been converted without having to do an application, and then the other group that will need to apply if they want to be evaluated for the program.
So will you share, since we are being televised, would you share with the general population for Pitt County how they can get into this program, since there are 7,000? Am I on the right chart?
That's correct, that's correct.
7,000 plus almost.
That's a
five.
projection over the next 2 years. That's the projected number, the two years of implementation, because we took the number for the two-year total, and I've subtracted the number that have already been converted, and so we have approximately 7,480 left. They can apply online at epass.nc.gov. They can print a paper application out from online if they have access to that. They can come into the office at 203 Government Circle and apply in person, or they can call our office and they can apply by telephone, and we can do the application by phone.
Can you tell them which, because when you are not into using the computer or whatever, what do you look for in that? I want them to have the services if they need it,
Right.
but tell them how to get to it.
Right, well, the web address is epass,
ePass.
EPASS
Thank you.
.nc.gov.
Thank you so
They
very
can
much.
apply for Medicaid, they can also apply for food and nutrition services, they can also apply for the energy programs. All of the online applications are available at that website.
Ron, can we get a link for this flyer that we could send out to folks? Do you have a link that you could
We
just
can
send the
get,
flyer?
we can get that for you.
Okay, perfect, thank you.
I have another question.
Okay.
Are you finished? Are you getting ready to sit down?
No, not until until we've answered the questions.
I would like very much for you to share with the general public about that first check that they received in the mail, and inform them.
You're
because
referring
they
to
may
the
not
LEAP,
understand
you're
it, 'cause
referring to
I've
the
had-
LEAP
I've
program.
had questions already.
Okay, all right. The Low Income Energy Assistance Program. In November, the supplements were done for all people who had qualified previously for the Crisis Intervention Program and the Low Income Energy Assistance Program last season. So everyone that qualified then received a one-time supplement. And those were either done electronically or either checks, where checks had to be written, the checks were mailed to the utility providers. That is the one-time supplement. So that has already been completed. Now, some of the providers may still be posting because it was one of the largest one-time supplement transfers they've ever done. So it's taken a while for the providers to get them posted. But that's been completed. People 60 and over who are also receiving food and nutrition services benefits received a letter in November, and that letter is about the benefit that they will receive for this LEAP season. And the letter instructed them to call in and report any provider changes or account number changes so that we could correct those before those applications. They run a report for those applications, and those payments will be made sometime in January. And those that got that letter that are 60 and over, their payment will be done automatically without initiating a new application. So that was the second group that was done, and that's for people that are 60 and over who are receiving food and nutrition services. And if any client has any question, if they call us, we can look at our report and we'll say, you know, we don't find you on the report, please apply. If there's any question and they want to apply, they can apply, but they don't have to apply. That will happen automatically. Now, people who are 60 and over not receiving food and nutrition services absolutely need to apply, because by already receiving food and nutrition services, their income has already been verified, and that's why the state can do an automated payment.
Thank you. I wanted that pointed out, and I also want you to clarify, because when you live in the rural area, the mailman might think he at one house and he's at another mailbox. So if that supplement, that one-time supplement for last session, and you know they received that money or that assistance,
Right.
they should have, because they approved it and got it. So how can they, what I'm trying to say, check to see if their payee received it?
If the provider
The
received it.
provider, yeah, I'm
Well,
sorry.
we can verify if it were sent electronically to the provider, or if we've written a check. We can verify that it was done, but once it gets to the provider, the client may have to call the provider. If it's not showing up and it's not being posted, then it's on the provider's end.
Okay, because if it showed, you all can tell them whether or not it showed up.
We can tell them whether or not it was issued.
Should have been
Yes,
showed
yes, absolutely.
Okay,
yes.
all right, thank you very much, because I've had questions about that already, and this is
Okay.
one way that the general public can know about it and
Okay.
understand it. Thank you so much, I appreciate it, and thank you for the statistics and charts.
You're welcome.
Brian, I know we've been talking for some months about Medicaid expansion coming, and there was really good news about additional staffing. Where are we with that?
Okay. We are interviewing later this week and next week. We have time blocked out, and applicants are being scheduled for interviews for the first group that we're going to interview. So that's happening this month.
Wonderful.
It is.
And Brian, you've already hired those supervisors,
We
correct?
have made decisions on 2 supervisors, but those have not been announced yet, but we've completed that process, yes.
How many new people we're getting?
13.
13, okay.
Right.
I couldn't remember it.
That's right.
Thank you. Well, that'll ease some stress, Madam PhD.
Any other questions for Brian? Thank you, Brian.
Thank you.
Next, we'll have the director's report.
Good afternoon, everyone. So, as we've just discussed, the Medicaid expansion began on this Friday, the 1st of December. Just some things that I've been working on. So, actually, our vice chair, Catherine Nelson, and I met with Sue Ann Pilgrim from the Injury Prevention Program at ECU, and we are going to start providing grand rounds 1 time per month for our employees. And I think our first grand round will be a documentary regarding LGBTQIA folks, and really understanding a little bit about how they define themselves, a little bit about what it's like to be able to live their life. And I'm hoping that what that will do is provide our workers with more information when they have parents and/or children that they're working with. And I don't know, Catherine, if I can just ask you a little bit, because you've seen the documentary.
Oh, yes.
Yeah, if you could just comment a little bit about that.
So we have a grant from NCDHHS for suicide prevention and firearm safety in our department at the hospital. And we have been probably in implementation well over almost almost 2 years. And the documentary talks about what it's like to live in eastern North Carolina and on Pitt County. If you identify in in that population, what the statistics are with individuals who have an ally with them versus if they don't with regard to suicide. And it's very telling. In this documentary, we also have people that we have a minister, I believe. I'm trying to remember back a year ago when I saw it. A minister, some parents, and then Pitt County residents that were at that time. And so it's very telling, and we've been invited to travel all over the state with this documentary, and we follow it up with I'm trying to think of the term. There's a group that sits before them. It's a Q&A type situation, like a panel discussion, and that's very effective too, very powerful. So we started it first, showed it first at on the ECU campus. So we're real excited about informing people and creating a lot of awareness with this.
How many, how far or how much in Pitt County has it been shown?
I'm not real sure, Mary. I do know we've been to NC State, we've been to Duke, we've been to Asheville with it. I think we also presented it at a conference in Colorado.
Because what about ministers right here?
I'm not sure, they may have shown it to some groups of ministers, but it is it's very powerful, and encourage our folks here at DSS to really invest in taking time to
Working on it.
participate in watching it.
So because it's, the documentary is an hour long, and we're looking at maybe like a 30-minute discussion afterwards. We're going to do like a lunch and learn program for them and provide them lunch. So, when you give them food, they will come, and so we want to make sure we have a good turnout.
I'd like to attend so that the secretary can catch it.
Okay. There's also a coordinator through the injury prevention program that talks about driving safety, vaping, and smoking marijuana. So we're looking at possibly, we have our foster children 18 to 21 to have them receive some information on that as well, and home safety, and looking at our parents as well as our foster parents to participate in that. This week, actually tomorrow, I have somebody coming from the North Carolina Department of Health and Human Services, Elizabeth Winstead. She is a local business liaison to actually talk about our budget, the different parts of our DSS budget, and I'm going to have our program managers participate in that budget training as well, so that they gain some information on their area and what part of the budget that they need to be looking at when it comes to spending. Typically what's been happening is we go through the budget officer, which is fine, but I think it's important for them to also have an understanding of their area and how the budget works, so that they can go in and look to see how they're spending their money, and being able to ask questions and be part of the whole budget process. One of the things I'm going to be attending, and it'll be January the 10th, is strategic planning, because I really want to be able to put a strategic plan together for the department. But I don't want to put a plan together that's just going to sit on the shelf and collect dust. I want it really to be a usable program with shared decision-making about what goes into that strategic plan as well. So more to come on that. We met with Trillium last week to talk about our children that are probably require the most attention with behavioral things, and most of them are, unfortunately, are adolescents, probably from 15 to 17 years old, and really looking at how do we work together better with those care coordinators through Trillium to make sure that we're finding permanent placements for these children or getting them the services that they need. And they're probably our most hard-to-place youth, but not just place them in a respite placement, but really looking at how do we move them into a permanent placement, which hopefully will lead to a permanent family and adoption. And one of the things that I would like to do at some point, and maybe even during our closed session today, is to talk about what agenda items the board would like to look at for the next year in 2024, and try to plan that ahead of time. You know, we meet on a monthly basis to plan our agenda, but I really think to hear from my board members what they would like to see the agenda look like in the year coming. And I just want to talk a little bit about the holidays that are coming up. December 8th is the first day of Hanukkah. My family celebrates Hanukkah. My daughter is actually Jewish, so we celebrate Christmas and Hanukkah in my home. And so I'm looking forward to this weekend, having our matzo ball soup, lighting our menorah, and having all of the Jewish food. I let her do the cooking when it comes to that because she's very good at it. We also celebrate Christmas, which will be December 25th. And I also want to talk a little bit about Kwanzaa today, just because I think it's a holiday for people of African descent, to be able to talk about how they want to celebrate their African roots. And it's really about the first fruits, and it's a 7-day long celebration, and it's about being united, self-determined, accountable for their community, financially invested in Black-owned businesses, and, you know, how they want to live their lives, and how it's not really tied to religion, but whatever their faith is, that they're following those tenets of their faith. So I just want to wish everybody the happy holidays that are coming, that are before us, and blessings to everyone.
Since you have those dates, could we get them on our website? Because Kwanzaa to a lot of people is a little new,
Okay?
and it may be a good thing. It is a cultural and a real self-determination kind of thing that people, the more we know about each other, the better off we are as a people. So I think that would be great to put it on our website. And it is a human resource center.
Absolutely. And it's the end of my report out.
Any other questions for the director? All right, next we have board member comments.
Thank you for the substantive board meeting and all the good information. Thank you,
This is
ECU.
our last meeting.
It's been wonderful.
For this year.
I whispered to Miss Sharon Rochelle, our director, and I said, "Is this our last board meeting for this year?" And she said, "Yes." So that's what I whispered about. And to all of you who are here and out in the land, enjoy yourself, eat healthy foods, be good to your neighbors as well as your family, and live the best way you can. Merry Christmas, Happy Hanukkah, Kwanzaa, and everything else you celebrate.
Any other comments? I would like to say thank you to the director and all of her staff for a great year. I mean, again, I always say sometimes I think the regular citizens just don't know what goes on at DSS, but I just want to give a thanks for a great year for the director and her staff.
Absolutely. I'll applaud that one.
Okay, I
See-
move that we go into closed session for personnel decision.
I'll
I
second.
All in favor?
Aye.
Aye.
Thank you, everyone. You can be dismissed.
I'd like to make a motion for us to adjourn.
I second.
All in favor?
Aye.
Adjourn.
Ah.